going. Thank you so much, everybody, for joining us on this Tuesday morning. We have a very exciting, important, timely topic to talk about. So today we will be presenting on electronic communication, privacy, and security best practices. Next slide. I'd first like to acknowledge that we are currently on the unceded and ancestral lands of the Musqueam, Squamish, and Tsleil-Waututh First Nations people. My name is Caitlin Shaw, and I am the manager of Doctors Technology Office at Doctors of BC. And today we have a very exciting and well-rounded panel of presenters. First, starting with Mori Matsusaka, who is a health technology advisor with DTO. We also have Dr. Lisa Honey, who is a physician advisor with the practice improvement at the CMPA. And then as well, we have Derek Puddester, who is Deputy Registrar at the College of Physicians and Surgeons of BC. So thank you to all of you for joining us. Next slide. Just a couple of housekeeping notes. Again, I think we're all getting very familiar with Zoom, but just to remind you, your control panel is at the bottom of your screen. It won't show up until you hover on top of it. You will see the Q&A box. This is the box that you can use throughout the presentation to put in any of your questions. And just keep in mind, actually, that questions can be upvoted. So if you have a question there that you think is really want the panelists to address, you can click the upvote button, and then it will actually move to the top of the Q&A. Also, right beside the Q&A box is the chat box. So this is not for questions. Please use this box if you're having any technical issues, and then our amazing admin team can help get you sorted if you can't hear your audio or whatnot. And then finally, we also have hand raising feature. So again, if you would like to speak at some point when we during the presentation or when we get to the Q&A, just raise your hand and then we can hopefully bring you off mute and have a discussion. Next slide. Just a conflict of interest. Just want to declare that there are no conflicts of interest from any of the panelists. Next slide. All right, the outline of what we will be discussing today, we will just quickly first set the stage about privacy and security in the time of COVID. We'll move on and spend the bulk of the presentation speaking to best practices for electronic communications and how to actually select the right e-communication tools. And then we'll make sure we save plenty of time for Q&A with the panelists, and then also be able to point you to a couple of additional resources to get more information on this topic. Next slide. So what are the learning objectives? So at the end of this packed 1 hour, the key takeaways we are hoping that you will have by the end of this. First is to be able to define the minimum provincial requirements for engaging in electronic communications with your patients. Secondly is to make sure or define the common guidelines around obtaining and documenting informed consent for electronic communication. And then finally, how to apply best practices for when and how to communicate electronically with your patients when using commonly used tools such as email, text, and video conferencing. Next slide. So just to help set the stage here before we get into really the meat and potatoes of the presentation, we know that with COVID, clinics had to very rapidly adopt virtual care and e-communication tools in order to continue to deliver care to their patients. So really the focus is being able to maintain the delivery of care, but meeting your patients where they are at, so where they're comfortable in also using these electronic communication tools. And just reminding us that as we're implementing these tools, there is still an obligation to make sure that we really are implementing security safeguards, and really the overall goal is to protect patient confidentiality. And just want to really remind everybody that it is very much small, everyday acts that can really help increase the security within your clinic, and just making your entire clinic team aware of the risks. And again, the really basic safeguards that can be implemented to protect patient confidentiality. Next slide. And now I'm going to pass it over to Maury to get into speaking about the digital communication policy requirements.
Excellent. Thanks, Caitlin. And welcome, everyone. Very happy to have you with us this morning. So I wanted to start off the discussion really laying the foundation of what the provincial guidelines, so to speak, have really stated are the key requirements. So the foundation requirements, minimum requirements that providers should have in place before engaging in communicating electronically with patients or caregivers. It's an exciting space where we're moving into using mobile devices and phones and so on, and it's really exciting to have that. But we also want to make sure that patients are aware of, some of the risks that are involved, not to scare them, but rather to empower them and help them understand how they can also work to protect themselves. So providing a reasonable notifications of risk can involve a couple different options. For example, even just having a discussion with your patients at the beginning of an interaction, when you're onboarding a new patient, having some sort of disclaimer, sort of outlining some of the risks related to electronic communications. And in the guide, the Patient in Care Team Digital Communications Policy, there's actually an appendix that providers are often encouraged to share that wording or something similar with their patients sort of at the outset to help set the stage for electronic communications. The second point that is pretty critical to in this new digital landscape is being able to validate the patient's identity. So oftentimes one of the biggest risks with electronic communications, whether email or otherwise, is sending things to the wrong person. And certainly when we're sharing personal health information, we want to avoid that instance. So the policy outlined above, and everyone will get access to a link for that, has a couple options. For example, having your patient send you their first initial email to validate that this is the email that that you should be sending any correspondence to, making sure that you have the latest and most up-to-date preferred email or phone number before you reach out to contact, and certainly other ways of verifying, for example, encrypting documents with sensitive information with something, a password that only the patient would know, for example, their birth date or some example like that. So just that extra little bit of safeguard so that we can ensure that the right people are getting the information, the private information that we're sharing. And lastly, we'll touch upon this a little bit further, but the importance of securing your personal devices, your work devices, etc., before you're using those new tools. And we'll talk a little bit about some of the best practices and what that looks like. Next slide, please. So we couldn't have a conversation about electronic communications without having a conversation about consent. And basically a lot of the pieces that we covered in the last slide are covered, that we're explaining the risks and the privacy issues. We're empowering patients by providing them perhaps some tips on how they can protect their own information. And definitely important is letting people know how their information is potentially going to be used in the delivery of care. That's really the key component. But the next key item that differentiates informed consent, and Angel tab over, is really ensuring that the patient fully understands the risks. So having some sort of acknowledgement or validation. So that can take place in a number of ways, but really having that, making sure that that connection is made with the patient before embarking upon a conversation electronically. And really, we want to emphasize that it's a process. It's really a conversation between the provider and the patient. And as we'll note on the next slide, signatures are important in documenting, but it's really that process of acknowledgement that's important. Next slide, please. So consent can be documented various ways, and this is often a question that we get. Does it have to be on a informed consent form, or can we have just a conversation? And both ways are valid. It's really making sure you have the ultimately the discussion. So the CMPA has a wonderful form that really outlines, all of the risks as well as the different things that you want to consider in that conversation, and that is downloadable via the CMPA website, and we'll share a copy that can be used within your practice. If you're starting out, for example, a virtual care visit, having a brief number of notes that you start out with just to set the conversation, and then documenting. The documenting is the other point, that you've actually had that conversation within the patient record in your EMR. And oftentimes we get questions here at DTO about, do we have to do this every single time we have a discussion? And it doesn't hurt to have that reminder, but really once you have it documented within your EMR, that's really, that really kind of covers a lot of the bases, unless, say, the information is being used for a new purpose, for example, research or something. And that's really what we want to always be making sure that primary purpose is clear to the client, how their information will be used. What's also important is that the patient should be able to retract that consent at any time. That's the aspect of consent that it can be given, but also retracted. For example, if they're feeling uncertain about how their information is being captured, etc., that there is a place within your clinic, very much so your privacy officer, who'll be able to field those questions, and also, if necessary, if there's a written request to retract consent, that can be facilitated. Next slide. So in terms of those safeguards to protect patient information, we have some high-level things that we always want to keep in mind. So certainly when it comes to restricting the disclosure of personal information, we always want to only provide what is necessary to whether deliver healthcare, et cetera, and only providing the information on a need-to-know basis. So that kind of really captures and highlights how we just want to be very mindful about the information that we're sharing and so forth. Certainly, if you are communicating things with private health information, et cetera, that we seek the most secure method that we have available. We'll talk a little bit about some of the different tools and how different ones have more levels of security or others, but that we're always looking at that, depending on the sensitivity of the information, sharing it through secure means. And certainly, we all have way too many files on our computers and our desktops. It's a good practice to maintain deleting some of those sensitive information if they are, for example, not in a more secure place, like your email, et cetera. By deleting it, once the purpose is fulfilled, you're also restricting the ability for that to potentially be accessed by somebody who isn't necessarily somebody who should be accessing, et cetera. And it's just a good practice in terms of, keeping that information sort of tightly locked down and secure. Next slide. So when it comes to mobile devices, and we live in a very more mobile world, so a couple technical tips being the doctor's technology office. So some key things, so keeping your operating system, your applications, and definitely having an antivirus and malware program in place is critical, but keeping it up to date so it is able to protect you from the latest threats, because cybersecurity is really evolving all the time, and we always want to make sure that we have the highest level of protection. Keeping your programs up to date is a good way of doing that. Certainly avoiding sending personal information while using public or Wi-Fi that's not password protected is key. I mean, most of us are not hanging out in coffee shops and airports these days, but certainly making sure that we're not sharing private information while we're on those networks, or if we are, there is something called a virtual private network, or VPN, some may be familiar with that, which enables you to kind of mask your own data so it's not potentially open for people to intercept while on those networks. The other option is, of course, using tools with end-to-end encryption, which really makes sure that whatever data you're sharing with your patient is only accessed by the person who's receiving it. So from provider to receiver, and we'll talk a little bit more about what that looks like in terms of tool sets and so forth. So enabling things like loss prevention. So, you know, every single time we set down our phone, having it time out after hopefully a short duration, so 5 or 10 seconds. So if that phone is accidentally taken or swiped, that they won't have access to the data that's on it. Another option that many phones have by default now, but you can certainly download programs, is a Find My Phone feature, which allows you to actually locate your phone if it's lost or stolen, but also erase the information that's on it so nobody can access it. So those are a couple really good tools to make sure that those devices, if they lose or if they get out of your hands, are a bit more safe. Everybody has downloaded a new application and has gotten that pop-up about, you know, do you provide permissions for this application to access, say, your camera or your files? You can actually control some of those permissions. Some of them are necessary for the functioning of the app, but many are optional. So, you know, take a second and actually take a look at what options are on the table, and where you can, especially if there is private information, make sure you lock that down or restrict that, just for that extra level of safety. And lastly, only downloading applications from trusted sources. So that can be the Google Play or the iPhone App Store, etc. But from vendors directly and not from, say, third-party websites. It just adds that extra layer of veracity, making sure that you're getting the right application from the right place. Next slide. Do we have any questions before we move into tools?
Yeah, that's a great place to answer a couple of questions that have come in through the Q&A box.
Yeah.
So going back to the informed consent piece, one question that came up is, do you need to collect consent if you are going to be providing care over the telephone? So assuming there's no video.
Maury, I don't mind jumping in to answer that one.
Yeah, sure.
So virtual care does certainly require consent, and whether that's via telephone or via a video platform. The issue with the telephone is the limitations of what you're able to do over the phone. So it is important to get consent to perform virtual care, understanding that the patient may need to present for a physical exam, depending on how things play out during the phone call. There are certain conditions that can't be assessed well over the phone. So the patients need to understand the limitations. And yes, virtual consent is important.
Thanks, Dr. Annie. Going back to consent, again, can the panel just speak to how often verbal consent should be collected for virtual care? Again, should it be every session? Should it be on a certain frequency, such as, you know, once every 3 or 4 months? Again, can you give a little more guidance around the frequency of collecting consent?
Happy to jump in again. So in terms of frequency of consent, I mean, there's no rules, but ideally it would be reasonable to just confirm it each time you speak to the patient. And, you know, you don't need to go through a fulsome consent discussion every time. I think it's okay to just say, you know, virtual consent confirmed, check in your documentation. As long as you've had that very fulsome discussion at the beginning, and if something is new or something has changed, then it's time to revisit the consent issue.
Exactly. And having that, even those verbal conversations is noted, documenting that in your EMR, and really that's that point of liability, that you had the conversation and that you have the documentation for that. We actually have some scripts, some sample sentences in our DTO virtual care toolkit as well, so that, you know, you don't have to start from scratch of what would it look like to document consent in the EMR, and we'll share that with you as part of the resources from this presentation.
Great.
I just emphasize, the process around consent is truly meant to be fluid and depends so much on the dynamic between the issue that your patient is bringing into clinic, and the methodology that you choose. So in the back of your mind, always thinking about, does my patient really understand the risk of us having a conversation that's limited to a telephone, or limited to, a poorly lit screen, or limited to an environment where there's a lot of background noise? Does my patient really understand that? Becomes really important. And then looking at all the other options to make sure that that care visit is done safely.
Jumping over to some of the conversation around when you're securing your devices, making sure you're deleting certain text messages or emails, and the concerns around, but that's part of the patient record. Why would you be deleting these these conversations with my patient? So can the panel just comment on how you actually navigate that scenario and meet your obligations?
Absolutely. I think maybe in clarifying, so emails that particularly that have private health information is what we're strongly sort of focusing on. And certainly having that email documentation, perhaps storing more of the private health information within your EMR, or having that conversation thread sort of brought into a more secure place is really kind of the focus, not so much that, hey, we're going to delete all of our emails as soon as we're done, but rather making sure that if it has more sensitive information, that it's stored in a secure manner. Certainly, if the rest of the panelists have any comments on that, happy to chime in.
Yes, I think it's important that you include that email as part of the EMR, but then to delete it from your your iPhone or your personal devices that you might have been using to perform that email exchange.
Yeah, and that just keeps it more secure in case of, say, loss or theft or any unauthorized access. So just making sure that it's stored in a secure manner.
Yeah, it's real. And I'd add that thinking about what do you need to document to show your intellectual footprint in your engagement with care, just becomes important. So you may have people who want to text you things, or I've had patients want to Snapchat something, and if it's clinically relevant and it becomes part of your decision making process, integrating that back into the record of truth, into the EMR, becomes extremely important.
Quite a few questions around that, so great to touch on that in more detail. Kind of one more thing that I think is very relevant around consent. One physician has raised that when their patients are booking their own virtual appointment, in order to book each appointment, they have to view a consent paragraph and click on "I understand." Is that sufficient for informed consent?
Can I jump in again?
Sure.
Is it sufficient? No. I think again, it's important that you allow that. The idea of informed consent is that patient is allowed to ask questions, and a form doesn't allow you to ask questions. And so it's important that you, as the physician, and this can be delegated, to your clinic staff, but that you make sure that the patient understands the risks of private health information, understands the limitations of virtual care, and it has the opportunity to ask any questions about that, and that you document that, Q&A done.
I will note as well that, the provincial policy on digital health notes that a notification of risks is acceptable. It's the minimum requirement, but what we're advocating for, so having a disclaimer sort of noting some of the risks is good. It's a good start to have, but really we're recommending that extra step be taken, that you have a more fulsome discussion, whether verbally or otherwise, or having a form just helps that conversation move forward, and that they can really see more fully what they're signing on to. And so I just want to clarify that distinguish difference in terms of that would meet the requirements in terms of notification of risks, but wouldn't go as far as that informed consent piece, which is certainly just a best practice to have documented.
Great, thanks everybody. And jumping over to, I think, one last question before we keep going. For securing mobile devices, a couple questions that are popping up around anti-malware and anti-virus. Are there any, how would you help, or how would you advise physicians on which which they should use, or how to navigate the various options for iPhones or Androids or the various platforms?
Certainly. Because we're vendor neutral, we can't rattle off a list of names. However, we do really encourage you to take a look at to have one. First of all, is a great start. There are so many different options out there, some really great, well-trusted providers that some of them even have free or low-cost antivirus, anti-malware options. So both on Android or iPhone, there are a plethora of options. And if you have specific questions or want to navigate those different vendors and see what the comparisons are, certainly reach out to dtoinfo@doctorsofbc.ca. We can have more of a discussion, and I can share perhaps some options for you to explore. But certainly in this presentation, we can't specifically endorse one or another. But I would encourage you to find something that works for your business process, your cost, budget, and so forth. And we can explore some of those options if you want to reach out and we can chat.
Great. So the main takeaways were make sure you have one. That's really most important. And secondly, please contact DTO and we can help navigate what questions you should be thinking about and how you can really select a platform that makes the most sense for you and your business. All right, let's jump back into the presentation. Thanks, everybody.
Awesome. Okay, so we said that we would have a conversation about, okay, what are the tools? What are the things that we should be thinking about in selecting the tools? So I mentioned end-to-end encryption, and basically that is a fancy way of, as I was saying before, the system is designed so that only the receiver and the sender are able to access the information that's being shared, whether it's video, web, etc. And that's almost seen as the industry highest standard for making sure that we're keeping our conversations private. There are many tools out there that have that functionality, and we certainly encourage, if you're sharing private health information, that you select tools with that highest level standard. There's a lot of conversation, and we're going to get into a little bit more about, I use Gmail or TELUS for my day-to-day operations in terms of emailing my patients. We're not saying don't ever use those systems. You've got them set up. We're not asking everybody to change over. The only thing we're perhaps emphasizing is if you're sharing sensitive private health information, be aware that those tools are not encrypted by default. So they're not sort of built for that sort of private health information exchange. They are encrypted to a point, but not to the level that we want to see when we're sharing that sensitive information and being able to protect it from, if it were to get out or intercepted, etc. So we just want to make sure that there's almost an extra level of diligence if we're sharing a document that is more sensitive, etc. And we're choosing more secure means, which we'll talk about. One thing that is a very popular thing to do, and it's part of HIPAA, which is the US privacy legislation, is actually, but we can do here in Canada as well, is requesting a business associate agreement from whichever vendor that you're working with. And this basically ensures that there's some sort of agreement with your vendor, that they understand what information that you are sharing, and they can actually configure the security settings of your application to be set up for healthcare use. So adding on extra layers of security, enabling end-to-end encryption, etc. Your vendor knows the system well. You don't have to do all the sort of back end. By engaging with your vendor, you can have more confidence that your whatever applications you happen to be using is really set up for the most secure use. Other considerations, certainly selecting tools that route or host data on Canadian servers. Now noted, this is more of a FOIPA or public institution policy. It is a requirement under FOIPA, but many of you probably know that right now a lot of that requirement is suspended temporarily due to virtual care or due to the pandemic and the need to really use a variety of virtual care tools, but it's still ideally a best practice because once we start hosting data in foreign jurisdictions, they are subject to those different laws. And so it's always a best practice for any private health information to be stored on Canadian servers that we know are complying with Canadian level of privacy legislation. So that's a good practice, not a full requirement under the private for private practice, but certainly something to consider. Lastly, checking with your health authority or regulatory bodies, as they may have done some privacy analysis, or they may have some direct recommendations about what tools are appropriate to use in their opinion, etc., so that you don't have to do a lot of the searching necessarily on your own. You can reach out to your peers and your regulatory bodies to get a little bit of input in those decisions. Next slide. So as I mentioned, we'd get back to email, and we really wanted to go through a little bit of like, okay, what can I use these tools for? And a lot of this information is in actually the PHSA Digital Health Toolkit, which we will also share at the end of the presentation. But I just want to touch upon like some of the key points. So for email, definitely we use it every day, and we should for certain things. So content that needs to be saved for future reference or record, for example, that can be easily saved as a PDF in your EMR, appointment reminders, follow-ups, status updates, those sorts of everyday things that, isn't private health data, but absolutely we need a medium to share it. And email is a great opportunity and option in terms of sharing that information, that kind of information. Things like providing directions or educational material links, etc. Absolutely, email is a great tool for that sort of thing. So the only thing we want to just make sure that there's a couple things that we're considering if we're going to use our email tools. So as I mentioned before, validating that you are sending to the correct contact. So that could be that suggestion to making sure that your patients are sending your clinic an email first, so that you're making sure that you're replying to the right person or having some way of validating identity, whether through a password only they would know, etc. So those are some of the things that we can mitigate those risks of sending to the wrong person. Certainly utilizing secure email options. There are vendors that are set up for healthcare use, and by default, as I mentioned before, actually have that encryption built in and the ability to encrypt files quickly with passwords. And then again, deleting sensitive files once the purpose is fulfilled. Next slide. We often talk about, get questions about text messaging and, is that appropriate to be using in a healthcare environment? So depends. Always favorite answer of privacy folks. So again, quick check-ins, appointment reminders, etc. Those sorts of very ad hoc things. Absolutely, why not? Have a text message, you have the phone numbers of your patient contacts. So sending them links, etc., that don't have private health information, totally fine to use. Couple things to think about though. If you are sharing the PHI, I'm going to sound like a broken record, make sure that you're using more encrypted tools. Remember that even if you're using a tool that says it has encryption, you have to have both the sender and the receiver using the same application to make sure you've got that two-way sort of privacy. So text messaging actually increasingly is being used by healthcare providers. So provider to provider conversations about healthcare. And there are a lot of tools that are actually built for that. So they're encrypted, they're locked down. And for example, not endorsing this, but Fraser Health uses microblogging MD to share quick sort of consultations, et cetera, between healthcare providers. And it's great for that sort of asynchronous, very fast moving sort of conversation, but the tool is built for that purpose. So just make sure of that. One thing as well to consider if you're sending bulk text messages, for example, a notification to your patients, there are tools that do that. Just be sure that you're aligning with the Canadian anti-spam legislation before you start doing blasts with text messaging. If you have questions about that, certainly reach out and we can talk a little bit more about that, but that's sort of like an advanced level thing that you might do. And the last thing just to think about is that if you're going to text message your patients, they're going to have your phone number and they will have the ability to call you or text message you back, perhaps at non-opportune hours. So there are a couple ways to maybe protect your own privacy in using just a clinic or a work dedicated phone so that you're not getting pinged while you're having dinner with your family. Other ways are if you have a personal number, you can actually mask your personal number so that you're not getting calls back and that they don't have access to that information. So just some things to consider if you are going to be using text messaging. Next slide, please. So there's a plethora of eCommunications options out there. We don't have enough time to go through all of them, but I just wanted to touch on a couple other options for you. And one thing that we often recommend is reach out to your EMR. They often have functionality, for example, a secure patient portal, which is set up so patient sets up a profile, they log in, they can do so much in terms of secure messaging, they can upload private files, and it's all being done within a portal. So like it's an ecosystem that's integrated with your EMR, but also secure. So that is a great option in terms of having secure communication and file sharing with your patients that's integrated with what you're already using. eFax is often something that's talked about, so certainly in labs or pharmacy. So this is moving away from paper fax, but actually being able to send a prescription, for example, to a pharmacy through digital means. So there are lots of great secure tools out there for that purpose. Having a website, a lot of folks have even just a basic website that you can share just your clinic information. There's tools you can integrate with appointment scheduling. Great way to be able to communicate with your patients and actually post some of those disclaimers on risk and things like that. So that is a tool. And certainly if you have questions about how to set your website up for maximum security, et cetera, please reach out as well. And lastly, manage file transfers. So this could be like a file sharing sort of service, which once again, patients can access to upload private information or that you can share a direct link for private documents, et cetera. So there's lots of options on the table. And certainly reach out if you have questions about any of these tools so that we can help you in navigating some of the options. Next slide.
All right, so I'm going to jump in at this point and switch gears a little bit. So up until now, we've been talking about e-communication. And so just to round that out, if we are looking at video conferencing, certainly there are some best used for and some risks that you need to think about. And I'm sure we can all think of examples where video conferencing can make a difference. You know, family conferences, speaking with other physicians. But if we're using video conferencing to do virtual care, it's important, as I mentioned earlier, that we get that consent. And Maury talked about how we get consent to share personal information and the risks about e-communication. But you've got to take it one step further at this point and just make sure that your patients understand the limitations and that there are some things that we just can't deal with virtually. And so some of the risks that we need to look at is making sure that you're talking to the right person. And you want to make sure that that there's password features to get into the waiting room, as well. And especially with a new consult, you want to make sure that you're talking to the right person. And again, we would do this in a hospital. We would do 2 patient identifiers, and so it's an easy thing just to have your patient hold up their health card or ask their birth date, and to just confirm that that the identity is the person you thought you were talking to. The other issue is to make sure that you're speaking from a secure location. Now, a lot of us are doing virtual care from home, and one of the things that that can really make a difference, in fact, is making sure that you're using headphones. Somebody asked if where my headphones were from. I mean, these are what I got out of my Apple iPhone box. They're nothing special, but it does protect a little bit of the privacy because the rest of my family can't hear what's going on. And the other thing is, don't have your computer in the kitchen table where your whole family is seeing what's happening with this patient, or next to a window. And the same goes for your patient on the other end. Make sure that they're in a private location and using a private computer, not using their employer's computer that may then have access to their personal information. And certainly avoid using any public or unprotected Wi-Fi to do your video conferencing. So next slide.
So we at the college, we've been very, very appreciative of how registrants have nimbly transitioned to using virtually enabled care to help in the pandemic. But we've also received an ever increasing number of concerns and complaints from the public when with some of their observations about their experience of virtual care. So we just thought we'd share a scenario that comes from the amalgamation of a couple of complaints. But this one, a 16-year-old female schedules a follow-up call for renewal of an oral contraceptive and acne medicine. And on the screen, you know, she appears sullen, not quite her usual self. And you notice a circular and dark discoloration on her right cheek. And she keeps looking off screen very quickly and then seems to look down. And of course, your spidey sense tingles and you ask if she's alone. And she quickly says yes, but very forcefully. And you pause, ask if there's anything else she would like to discuss. She says no. And she asks you to fax the renewals to her pharmacy and then hangs up. She closes the laptop and is done. And so when, you know, I'd be curious what the group may think. You could feel free to put it in your Q&A box about things like, you know, explaining risks. How do you validate things like ID and privacy? What are some of the safety issues that come up? Welcome any comments people may have, including you, Lisa, when any thoughts come to mind for you.
Well, the one thing that I think is really interesting about this case is that if this were a telemedicine encounter, we wouldn't have caught any of this. And I mean, maybe a very astute person would understand that this patient is being furtive and uncomfortable. But the video has added so much richness to this encounter. We can see the bruising on her face. We can see the furtive glances. You know there's somebody listening. And so I know a lot of us are using telemedicine, but this is a nice example of where the video can really help you.
And I'm just looking to see if there's any comments from the audience on this case. You know, we did have a presentation from an examination company, and you know, they were going over how they secure privacy and confidentiality, and they take participants through, you know, moving the camera on their screen, you know, around the room, to confirm that there's no one else present in the room. Um, and it just, I think these sorts of scenarios raise concerns about true privacy and confidentiality. And what was nice in this particular case was the care provider taking that moment to ask if they were alone, and then scheduling an appropriate follow-up, to reach back out to the patient.
As well, Derek, I think it's important that, you know, again, with face-to-face encounters, we would often see a patient and a family member. It's okay to have a family member participate, as long as you ask them, you know, who else is listening on this call, and let's include them, and let's document that that this call was with the patient and their husband or father or something.
Absolutely, and then we get that added benefit of, you know, having the family providing collateral and additional perspectives and engaging in our follow-up strategy with our patients. So there are things about the virtual world that actually enable our tighter connection with a patient and their support network. But Lisa, really agree with you around the documentation and the inquiry, active inquiry about making sure we know who's involved in the care visit.
Great. And one question I also wanted to raise, you know, the same scenario is, would it be appropriate or would it be expected that as a physician you ask the patient that they give their consent, that they have someone joining them in the visit, or is it expected that they are giving their consent because the person is there with them?
Yeah, we've had, you know, I can think of several complaints from the public where the real core of the complaint was from the patient saying that their physician made an assumption, that because they showed up with someone, it was okay to provide them with personal health information. Complex moment, right? I mean, people show up with people, and you sort of think about, well, there's an implied level of consent there, but there can be power over issues that you know, may bring us that moment to pause. If we think about minors, if we have any sense that there may be a history of domestic violence, if we think about vulnerable older people, you know, there just may be that opportunity to take that moment and say, I just need a moment with my patient, and I want to make sure I just have a few moments together, and then you can use that as an opportunity to ascertain genuine consent and then document it carefully.
Anything else really in the Q&A related directly to this example? I know we have some other scenarios. Also, just wanted to remind people that please feel free to raise your hand on the bottom of your screen, and then that will show up, and we can also take you off mute if you'd like to speak up directly.
I suppose the other thing that this scenario raises is the concern that we have about so many isolated young women, that abuse may in fact be on the rise, and it's something that we need to be more attuned to. And you know, the interesting bit is that the video gives us a glimpse into this person's life. It gives us a little glimpse into their environment as well. And clearly this is an unsafe environment. And this, you know, I would hope that the physician that's taking this call arranges to meet this young girl face to face to find out what's truly going on.
Yeah.
So this is a great example of a case that needs to be brought in and seen face to face.
Lisa, it reminds me of Maury's statement earlier this morning. You know, seek the most secure setting, and really use the clinical scenario to guide you in that. So again, I think most of us looking at this would be, I really want to have an opportunity to meet with this person privately.
Yeah. And I think Stanley Hurwitz, I believe, had a nice note that you know, patient stated she was in a private location, and then they noticed a workplace surveillance camera in the background. Can't really do that on the phone, and so it just informs you. And also empowering and educating your patient about things to look out for to protect their own safety and privacy. So certainly there's a lot of considerations. I mean, many tools are great to use, but having that extra bit of data and being able to see surroundings can sometimes be very powerful.
Mm-hmm. Mm-hmm.
Should we go to some of the other questions in the chat?
Well, sorry, yes. Just thinking before we jump over, another interesting point that came up, and I know it's come up before, is around where the physician and the patient are located when providing virtual care visits. And do you need to confirm where the patient is located? And just a lot of, I know, questions have been coming up around, to the CMPA and through the college, do both the patient and the provider need to be located within the same province, or what is the, how do you help physicians navigate that question?
That's a sticky issue, Caitlin. Ideally, your patient and your physician are in the same province. If this is a patient that you have been looking after for some time and you're well acquainted with them, and they're in Florida and they're having an emergency, I think that it's quite reasonable to deal with that patient. But different provinces have different rules. And perhaps, Derek, you could speak to what the rules are in BC.
Yeah, and so much of this is actually quite practical. So for example, we were getting earlier in the pandemic, we were getting phone calls from psychiatrists in different parts of the country who were offering care to citizens of British Columbia. But their questions were, what's your mental health act like? And if I need to certify someone, what do I do? And it really gave us a moment to sort of pause and say, before you enter into a care relationship with a patient in British Columbia, our college would expect and would hold people accountable to, knowing the relevant legislation that applies to that. And of course, if you don't, then we would have concerns with that. So part of it is very much a common sense approach. What do I need to know to practice safely with this patient in the jurisdiction? The other piece is, I think if people are outside of the country, you may be putting yourself and the patient at risk of legal complications, technological complications that you may both be unaware of, and that can threaten the validity of your informed consent discussion. And of course, you may be held accountable to different processes. So just practically, it just makes good sense to understand the jurisdiction where the patient is and to be very mindful of the framework that you're practicing under. And if you're not, then don't.
That's great. And if a physician has questions around these sorts of scenarios, is it recommended that they reach out to the CMPA or the college or both? Where can they go to clarify?
I would definitely recommend calling the CMPA, and we can give you specific advice about specific patient encounters, and everything. Every encounter is going to have little nuances and little differences. So if you have questions and you're concerned, by all means, reach out.
And people are also welcome to contact us at the college. We're more than happy to walk through our standards, our guidelines, our processes. What I will, however, encourage people to do is if you think that you're at medical legal risk and you want to start to share specifics, I'd probably encourage you to call the CMPA first and have that conversation with them, and they can guide you on next steps, including when to reach out to us.
Perfect. That's great. I know we only have a couple of minutes left. So I was thinking maybe switch gears for the last 2 to 3 minutes, and then we can close off the presentation because we do want to make sure we do finish on time. And one question I know you had kind of marked to make sure we responded to, Dr. Podester, was going back to email and the concern from physicians that if they have set up a clinic email, that there is going to be the expectation from patients that they can then email the clinic back and get a response or expect some level of care. And how do physicians mitigate that?
Yeah, so my quick thought is this is a great way to have a threat to the, that close relationship you build with your patients. And they think that you're going to offer them something and you're going to disappoint them, and it may not be gentle. So right off the bat, it starts to threaten the relationship, and we don't want that. So if you're going to be offering email communication with patients, just make it like explicitly clear, multiple reminders, and manage those expectations from the very beginning. And I know some clinics will even have a bounce back email with a plain language statement, something very simple. I won't respond to, or we can respond to. Please call instead if an emergency. Do those sorts of things. So really just manage this expectation clearly from the beginning, and not actually discourage a lot of discussion in email. I think keep it in the context of your patient care visit, because we all know email's not bad, but it doesn't replace a genuine conversation about sensitive issues. So choose it carefully.
And one other thing topic I wanted to bring up was questions that are coming up around websites, and how can someone create a secure website? Are there services available through DTO or other organizations? And we know that websites are a great way to be able to communicate to your patients these services I will be offering, letting them know if you do have virtual care as a service offering and how they can book appointments. And one point that was raised by, we have Dr. Monk and Dr. Ross on the line, is around just reminding folks about the Pathways Virtual Care Directory and how that is a great resource for physicians to be able to post on the public facing directory about what services are available through their clinic. So just want to set a reminder for everybody around that. You don't need to necessarily go and make your own clinic website. You can actually link forms to your Pathways directory. And again, it's a great place to really keep your patients informed about how they can contact you and set expectations around what's available virtually.
And certainly if folks have more detailed questions about secure web hosting and setting up like which vendors might have better security and things like that, please do reach out to us, and we can certainly have a conversation at DTO to help provide some recommendations.
Great.
I think that's one of the, sorry, I'm just going to jump in.
Yeah.
One of the things is we don't need to reinvent the wheel. There are great resources out there. There's, DTO has the toolkit, and the CMA has the virtual care playbook. And, all of these processes have been worked through, and call and use DTO to set up your processes, because this is new to all of us, although I suppose not so new anymore, but we're all working through this together, and there's no point in us all reinventing the wheel. So use the resources available to you.
Good segue into resources, but before we jump off, notice that there are a couple great questions under anonymous attendee. Absolutely reach out to us to make sure that we have your email and we can answer those. We'll stay on the line for definitely some more questions, but before that person drops off, please let us know your contact so that we can make sure we can follow up. And Caitlin, if you want to chat about resources.
Yeah, Angel, if you want to jump through. I've been told my audio isn't very great, so this is a great reminder to everybody to wear a headset because it really can improve your audio, so I do apologize for that. Quickly just finishing up here, as Maury mentioned, we do have quite a few additional resources. We will be sending out an email following this webinar that will include all of these links, but just to remind everybody that PHSA does have a great toolkit that they have put together. So definitely recommend going there, and again, getting a little more info around using email and text messaging and others virtual care platforms. Also, there is the provincial patient and team care team digital communications policy, sorry, that we talked about at the beginning of the session. So we will also include a link to that. And then through DTO, we have a whole suite of resources available to really help you get started using virtual care. And as mentioned there, we do also have one-on-one support through our health technology advisors, as well as coaching through the practice support program and peer mentors. So lots of different supports available depending on your style of learning and the sort of support that you need that's best suited for you and your needs. Next slide. And again, a bunch of amazing resources from the college and from the CMPA. So really recommend going and looking through these, the practice standards, and some great guidance from the CMPA around using electronic communications, as well as the CMPA consent form. And then the OIPC as well has some very relevant resources. And next. All right, and that brings us to the very end. I apologize, we're a few minutes over time. Thank you everybody for joining us. Really appreciate you coming on an early Tuesday morning. Thank you so much to our entire panel. This was a great discussion. Really appreciate everybody taking the time to talk about this very important topic. If anybody does have more questions, please email dtoinfo@doctorsofbc.ca and we can make sure you're responded to or triage to the more appropriate resource, either CMPA or college or whatnot, but we can help you get to the right person. And on that note, we will end the broadcast, but I believe that we will stay on for a couple extra minutes. If people have burning questions, they really want to take advantage of having Dr. Honey and Dr. Pudister here. So I will say, just raise your hand if you do want to discuss anything further, and that way we can bring you off mute. But otherwise, thank you to everybody for joining us and have a great rest of your day.